Assalamu alaikum wa rahmatullahi wa barakatuh. Still on hijama, the need for knowledge. Like we said, hijama is a medical procedure. Alhamdulillah, barakallah fiha. It is also a sunnah. But like every other medical procedure, there is a need to know how to do it, why to do it, and when to do it. If you don't know that, or your therapist doesn't know that, then you have a small technical issue that could cause big problems as you go. Now, for a therapist or for a patient, there's a need to understand that there are so many points on the body that can be cupped for various ailments. About 145 with some charts, some slightly more, some slightly less. Outside these, there are also special points that are used to treat certain special cases. So the need to learn. I call on everybody that practices cupping therapy, who wants to learn to practice or who has intentions to practice cupping therapy, to come and learn, to understand the relationship between cupping and hijama, and if there's any difference, what it is. Like we've said so many times, hijama itself, cupping therapy, has been around for very, very long. Nobody would really tell you when or which era or with which prophet it came. We know there were 125,000 prophets, and we don't know them all. Only about 23 or so odd numbers have been mentioned in the Quran, but we've been told there have been lots of prophets, so we don't know whose era it came in. But it's here, alhamdulillah. The Hatim al-Nabi, Nabi sallallahu alaihi wasallam, put a stamp on it and told us how important, how necessary, how useful to our lives hijama is. So there's a need to learn, and we should not practice hijama without knowledge, and we should not let people practice hijama on us if we're not satisfied that they know what they're doing, that they have diagnosed and seen what is wrong with us if we're treating an ailment. Where we want to do hijama just to fulfill a sunnah, we're fine, we're well, we're healthy, but we want to fulfill a sunnah. We want to get the reward of having performed an act that is sunnah. The therapist must also be able to understand why we want to do it. He or she must be able to verify after examining us that we are fit to do it. And from what he or she finds out from that examination, it will inform the therapist to add in what points he or she feels necessary outside the various sunnah points, which in some countings are 6, in some countings are 7. So inshallah, we will continue talking about hijama. We'll continue talking about cupping therapy. And as we go on, we will digress and start programs on traditional African medicine, herbal parts of it, the temperamental theory to it. We would digress into dry needling and acupuncture as alternates and cures that can be used. Please like, share, follow, comment, ask questions, and inshallah we will be updating as we go. Jazakallahu khairan, barakallahu feekum.